I had fetoscopic laser surgery at 22 weeks pregnant. Hi, my name's Christine. If you don't know me, I am a mother of 5 boys, and I'm currently pregnant with twins. The type of twins I have are called MODI, monochorionic diamniotic, which is 2 sacs but 1 placenta. They are identical. When you have twins that share a placenta, there are a multitude of things that could go wrong. You're usually seen by your OB and a high-risk doctor known as an MFM, maternal fetal medicine doctor, to monitor these problems that cause you to be high risk. One of them being twin-to-twin transfusion syndrome, which is what we had. Me and the twins. The twins? Just the twins? I'm just their host. Okay, that made them sound like a parasite. Anyways, so twin-to-twin transfusion syndrome, or TTTS, is diagnosed in stages. Stage 1 starts off as a fluid discordance, and stage 5 is fetal death of one or both twins. It is a very serious condition, and it can go from you don't have it to you're at stage 5 very quickly. That's why it's important to be monitored by the high-risk doctor. Sometimes moms, by the time they get to the high-risk doctor, it's already too late and there's nothing that can be done to save their twins. So basically, how you get TTTS, the umbilical cords go into the placenta and the blood vessels spread out. As the placenta grows, the blood vessels connect. They're not supposed to connect. Sometimes they connect. And depending on if they're veins or arteries, like one baby might have more blood going to it than the other baby. So it's not flowing back and forth equally, which means one baby's getting more blood and one baby's getting less blood. That's how stage 1 starts with the fluid discordance, because when your baby has a high blood volume, they're peeing a lot, which makes their fluid go up, whereas your other baby doesn't have as much blood, they're not peeing as much, their fluid levels are depleting. So that is stage 1 and how it progresses and how it starts. The laser is when they go in and laser those connecting blood vessels apart so that your babies are each on their own blood supply circulation, instead of like essentially pumping the blood back and forth to each other, which can put stress on their hearts and different organs in their body. Now, when I found out I was having the MODI twins that are more high risk than DI twins, I did a lot of reading. So I had knowledge of the things that could go wrong, which in the end ended up helping me be empowered in my situation. I know they say like, oh, don't Google because then all you're going to do is worry. But I'm so thankful that I Googled and I gave myself the knowledge to understand what could potentially go wrong in my pregnancy. So our TTTS story starts when I was about 15 weeks. This was way back before Thanksgiving. I went to one of those ultrasound boutique places. I wanted my husband to come. He never gets to come to appointments with me. The kids could come. It was going to be like this fun thing. Everybody got to see the twins. Baby A at this appointment did not look right to me. We did not get very good pictures of baby A, and it made me worry. It made me feel uncomfortable, just looking a little funky. I didn't like it. I didn't sleep that night. The ultrasound tech didn't give me like any medical advice. They're not allowed, but just like I just knew, mother's intuition, something was not right. So the next day I call my OB and I just want them to, take a peek, make sure everything's okay. And they're like, oh, your babies are fine. You don't need to come in. How do you know my babies are fine over the phone? And they're like, the ultrasound tech that did the ultrasound was not a medical professional. Okay, well, she didn't give me any medical advice. This is based off of what I'm seeing, what I saw with my own eyes. Well, you're not a medical professional either, and if something was wrong, she would have told you. Well, you just told me. She's not a medical professional. So which is it? It was the week before Thanksgiving. It was like Thursday. We were going away for Thanksgiving to my parents' house in Pittsburgh, and I just wanted to be seen and make sure everything is okay before I left for Pittsburgh so I can enjoy my Thanksgiving with my family. So they're like, fine, if you really think you need to come in, you can come in. You bet your bottom dollar I'm coming in. So I go in. The ultrasound tech, not nice to me. she gives me this spiel about how it's too early for anything like this to be happening, which is not true because Johns Hopkins starts their laser surgery at 15 weeks and I was already over 15 weeks. So, false. I didn't like that. She wasn't very nice to me. I didn't like that. Then the midwife comes in and she gives me the "I told you so" speech. I feel like just because both twins had a heartbeat, she's like, obviously they're fine. I felt like I knew more about TTTS than the midwife did. And I didn't like how she treated me. You're not going to belittle me. You're not going to gaslight me and make me think I'm crazy. And of course, at the end of the appointment, she's like, and don't go to those ultrasound boutique places. And I'm thinking in my head, like, thank God I went to that ultrasound boutique place. So the next day comes. It's Friday now. Not satisfied with what they said, how they treated me. Never going back there ever again. I call up my MFM and I'm like, okay, here's the situation. I want to know if you can get me in before Thanksgiving. That gives me like Monday and Tuesday because I'm leaving Wednesday. Somehow, some way, they managed to squeeze me in. November 21st comes around and the doctor there is like, yes, you definitely have some fluid discoordinates. I want you to come back in a week. Now, at this point, I was only being seen by them every 2 weeks. So obviously, something was going on that they wanted to see me sooner than every 2 weeks. We enjoy our Thanksgiving with family, and I come back a week later on November 28th. And the doctor I saw that day, he was like, you need surgery by the end of the week. And I was completely and totally freaked out. So he's like, I'm going to put a referral in with Johns Hopkins, and they're going to call you. And you need to go there as soon as you can. So I have my first appointment with Johns Hopkins Fetal Therapy Center December 1st. That's how quick they got me in because he was like, her twins need this surgery like now, like yesterday. But then I have my first appointment there. They do a long ultrasound. They check all the things. And it turns out I didn't need surgery. But they're like, we want to see you twice a week. Johns Hopkins was very happy that I was knowledgeable enough to be able to advocate for myself and for my babies because they couldn't believe that my OB had treated me like that. The doctor I saw on the first day, she wanted to call up my OB and give them a piece of her mind. She's like, don't worry, I'll be nice. So for 5 weeks, twice a week, I drove all the way down to Baltimore, which is an hour and a half from me. So an hour and a half there and an hour and a half home. The baby that had too much fluid, the fluid amount kept growing and growing and growing. But the other baby's fluid was staying right above 2 or like within the 2 to 4 range. So it wasn't low enough to consider me stage 1. So every appointment, they're like, oh, we're just going to keep watching. Oh, we're just going to keep watching. Johns Hopkins switches their babies based off of who's the donor and who's the recipient. Your donor baby is the one that has less blood because they're like donating all of their blood to their sibling. And the recipient is the one that has more blood because they're receiving all of the blood. It was to the point where my recipient baby A at this point, because they had switched them, had 16 centimeters of fluid. They don't want it above 8. Like once you hit 8 and the other baby is below 2, that's when you're considered stage 1. Baby B is hovering at within normal range and baby A has 16 centimeters of fluid. My stomach was so big. It was like a rock. And nobody at Johns Hopkins could understand how I was so happy because they're like, usually patients, when they have this much extra fluid, are miserable. I was just happy to be in their care and be taken care of. And I felt like good inside. They made me feel confident. Pregnancy comes with, it's uncomfortable. It's not always rainbows and sunshines. But I don't let that affect me. I try to be positive, especially, at the hospital where it could be kind of doom and gloom. So I try to just put on my best face and be happy. And they were just like, who are you? They were worried about my cervix shortening because I had so much fluid, but it wasn't. It was staying strong. It felt like repeating the same appointment all over and over. They did the same ultrasound, checked the same things, and it was like, nope, not yet. Nope, not yet. Nope, still not yet. Nope, not yet. It just kind of felt like repetitive. And then on that one January 3rd, I go in and they're like, today's the day. we need you to come back tomorrow, 5 a.m. for surgery. And now I'm freaking out because this whole time I've been like, oh, it's just another day at Johns Hopkins. And now it's like the real deal. I was nervous. It was like impending doom because I knew it was coming, but it was just a matter of when. When you have stage 2 TTTS, that's when the baby that has less fluid has no visible bladder. And then stage 3 is when you can start seeing the stress on the hearts on their Dopplers. Like you see regurgitation and the blood is flowing back and forth instead of just in one direction. Because they're essentially working together, but one has more blood than the other. So it's a lot of stress on their hearts, but in different ways. I knew surgery was coming and it was finally here. I was a nervous wreck because if you look up the statistics, they're not very good. I think they're like 60% chance of both twins making it, which honestly, that's kind of low if you ask me. Also, if you don't treat the twin to twin, the outcome is usually you lose one or both. So it was like lose-lose. Like you can wait it out and potentially lose both twins, or you can try to fix it and potentially lose both twins. It's just a whole lot. A lot of risks came with surgery. Like your water could break, you could go into labor and birth the babies right there. So many things could go wrong. It's a lot to think about. This is the best decision for me and the babies to help them. So they're like, go home, eat dinner. After dinner, eat nothing. No food or drink. Fasting. Come in fasted, 5 a.m. We'll meet you here. We got you. So the next day comes, me and my husband drive down there. My mom comes down so she can watch the kids, get the big ones to school, hang out with the little ones. I'm in labor and delivery unit. I'm in a triage room. They're prepping me for surgery. They're doing blood work, getting a catheter in because you're on magnesium. And when you're on magnesium, they don't let you get up from your bed. So they put a catheter in, which was probably the worst part of the whole experience. They do, your IV and all that. I met the team, like the anesthesiologist team. Johns Hopkins is like a schooling hospital. So I met with a lot of people. There was just a lot of people everywhere observing. And of course, my doctor came in and, went over the procedure. I mean, they had went over it the day before, but just, double check, make sure I knew what was going on, asked if I had any questions. And then she says, I'll be confident when this is over. That's how the conversation ended. And I'm like, is that supposed to make me feel better? It was a lot. I understood. That's a lot of pressure to be putting on one person. I could totally understand, but I was just like not prepared for her to say that. By 7:30, they had me in the OR prepping. They have the ultrasound going. They put a curtain up like they do with a C-section, that type of thing. So they don't put you to sleep. You're not sleeping. They don't give you like an epidural or anything like that. Like I was just fully awake, fully present. They put you on magnesium to try to help control contractions, since they're going to be sticking an instrument through your uterus into one of the baby's amniotic sacs. My husband got to put on the fun doctor outfit. He had to cover his hair, cover his beard, put a mask on. He had the whole paper suit, cover his shoes. And he got to watch the whole thing on the camera that they were using in the fetal scope. And he totally saw one of our baby's legs, foot. He could see the babies in real time floating around, which is just crazy. They did give me some fentanyl to take the edge off, but it was next to none. They told me I did really good. I mean, maybe they just say this to all their patients, but they just couldn't believe how little bit I had. They want you to be awake for the procedure so that you're more in control of your body, because they want you to be still while they're doing the procedure. So they used a laser, they cut the blood vessels. She called them gigantic. No, she called them grande vessels. She said she's never seen vessels so big. And my husband said they looked like night crawlers. So they take the laser and, they laser from one side of the placenta down to the other and make sure they get all of the blood vessels. This is called the Solomon method. And sometimes if they don't use it, you can suffer from post-laser taps, which is something else that you have to worry about. The surgery took about an hour, and when it was over, they drained all the extra fluid from baby A's sac. It was 2.5 liters. So think like a bottle of pop plus some. I could literally feel my stomach deflating as they were doing that. It was so crazy. My stomach felt so small after surgery. I was like, where'd my stomach go? Like, it was gone. I mean, it wasn't gone. It was still big. But compared to the rock that I had that was like making it hard to breathe, this felt completely different. So I had to stay in the hospital overnight. They wanted to monitor me for contractions to make sure, I wasn't going into labor, to make sure my water didn't break, those types of things. So they had me on magnesium until the next day at 6 a.m. So I wasn't allowed to get up till the next day at 6 a.m. I was trapped in the bed, couldn't get up to go pee or anything. I don't think I got any sleep. The nurse came in once every hour on the hour. I was also strapped to the bed by like 7 different things. I had like my catheter. I had these things on my legs to prevent blood clots that keep the blood moving. So they were each attached to the bed. I had my IV. I had the blood pressure cuff that went off once an hour. I had the contraction monitor on my stomach. Like, I had so many things hooked up to me. I'm like, okay, how am I supposed to sleep? I had to sleep like this. And I didn't get to eat anything until like 9 p.m. that night. 9 p.m. So like I hadn't eaten for almost a full like 24 hours. It was probably 24 hours at least. They had me on like a liquid clear diet. So they were feeding me things like ice, broth. They finally let me eat at like 9 p.m. and I took one bite and I thought I was gonna throw up. So then they came and brought me anti-nausea meds and I was able to eat like a little bit. I think I had just gone so long without eating to just starve the lady that's pregnant with twins. And I didn't know they had like Italian ice and broth and things like that until way later in the day. So things I could have been eating all day long after my surgery, I didn't get until like 6 p.m. Then the next day, they take me off the mag. Everything looks good. I'm not having contractions. They really like that. I guess it's not the norm. I go back down to the fetal therapy center for another ultrasound. They check all the same things and everybody looks good. The doctor comes in and she's like, do you want to go sleep in your own bed tonight? And my husband's like, yes, we do. It was nice. She let us go home. She's like, you do have to come back tomorrow for another ultrasound. And we're like, that's fine. We don't care. We don't want to sleep here another night. It's not a 5-star hotel. Sorry. The twins did have some edema under their skin in their skull. So there was like fluid building up between their skull and their skin. But she said that was normal and she expected that to happen because the blood vessels were so big. And she basically just, by lasering them, she just put a wall right in between the two babies that had been sharing their blood flow. Now all of a sudden it just stopped. So she did expect that to happen. We come back the next day. Both of the babies still had the edema on the skull, but one of the babies, it had moved down to the chest, and she said all of that's normal. Don't worry about it. I'm now like 3-4 weeks post-op. It's resolved. They don't have that anymore. After that, they were like, okay, we'll see you in a week. And that was the longest I had gone between appointments since Thanksgiving. It was the longest week of my life because I knew so much and knew so many things could go wrong. I was afraid I was gonna go to my next appointment and get like the worst news ever. I was on 2 weeks of modified bed rest, so they wanted me to just hang out and relax and not do too much, but it wasn't like strict bed rest where I wasn't allowed to get up. I had friends and family and lots of help. Everybody rotated out and took a turn, which I appreciated so much. They were very helpful, cooked dinner, helped with the boys. It was a nice 2 weeks. Tomorrow I go back for another appointment, for my weekly appointment, and they will be doing echoes on both babies. It's just standard, something they do 4 weeks after surgery to just make sure everybody's heart is functioning well and there's not anything that they need to watch out for, because the TTS and the surgery just puts a lot of stress on the heart and other organs too, but the heart as well. So I'll be excited to take a peek at the babies. I know like going to Johns Hopkins is like stressful and it does take a lot out of me, like that whole day just driving there and driving back, and I'm like mentally exhausted, but I do like checking in on the babies and they're so thorough there. This is how thorough they are. This is the cost of one appointment at Johns Hopkins, not the surgery, just one of my regular appointments. And I think I've been seen there like almost 20 times. Thank God for insurance, because that's a hefty price tag. So I'm very thankful for Dr. Miller, who did this surgery. She essentially saved my twins. Both of them have been recovering well and looking good. They're 40 grams off from each other, so they're practically the same size, measuring right on track. I don't know if they're gonna release me back to the MFM where I had been going in the beginning, or if they're gonna want to keep seeing me. I guess I'll find out more tomorrow. Johns Hopkins specifically, like, there's not a whole ton of hospitals that do this surgery. Like, some moms who end up with TTTS have to fly to a hospital that can do the surgery because they're not close to one. Luckily, Baltimore is only an hour and a half from me. I know they also do it in Philadelphia, which is like 3 hours from me. So I kind of like lucked out and ended up in a good spot. Johns Hopkins, they printed me out their own stat sheet versus the 60% chance of both twins making it, and their stats from all the lasers they've completed was like 80% or 85%. So it made me feel a lot better and a lot more comfortable going into the surgery. And of course, now we're 4 weeks out. We're still in a recovery period, but everybody seems to be recovering well. So in my next update, I'll be sure to let you know how the echoes go and if they're gonna keep seeing me there or they're gonna release me back to my MFM. Here's my belly scar. So that little mark right there is where they went in with the laser. And that's the twin belly at 26 weeks, because we're 26 weeks exactly today. So that's been my journey with twin-to-twin transfusion syndrome so far. It's been a lot, and I'm so thankful for all the people who have been there for me to lean on, who've prayed for us, who sent dinner, who sent gas money to try to take away some of the financial burden of driving 3 hours twice a week, friends helping with the older kids and getting them to school. And it just like meant so much to me because I don't feel like I deserve those types of things, and to see like people really help out with the boys in the 2 weeks after, and I just appreciate it so much. So thank you to them and Johns Hopkins and Dr. Miller. And yeah, before I cry, I'm gonna go. All right, bye. I'll see you in my next video. And when it was over, they drained all the extra fluid from baby BA. Why are there so many fuzzies floating around? Okay.